everyone. Thanks so much for joining us for Ask the Expert North Texas. I'm Kristen Diaz.
I'm David Rankin. It's been a year since the federal government moved the Suicide Prevention Hotline to a single three-digit telephone number, 988. And so far, millions of people have called that line in the last year, but it could be only the tip of the iceberg, though. Question is, do people know about this? On today's Ask the Expert, we're joined by Greg Hansch. He's the executive director of NAMI Texas. He is in the KRLD Zoom room. Greg, thank you so much for the time.
Absolutely. Thanks for having me.
How has 988 worked out so far?
Well, we're heading in the right direction. This is an extraordinary resource that has been made available nationwide. More people are calling the National Suicide Prevention Lifeline than ever before. Our in-state call answer rate, which is a very important metric, has gone up to over 75%, and it was below 50% not long ago. So more Texans are connecting with trained crisis counselors in Texas than ever before. And yet not enough people, broadly speaking, are aware of this incredible resource. And we think that's kind of the next frontier, is spreading that awareness.
So that's your biggest challenge right now. How are you guys teaming up to battle that?
Well, we're part of the movement to raise awareness about the 988 Lifeline. I was just in Dallas over the weekend talking with a community event there in Oak Cliff and sharing with them that this resource is available. And when I asked the question, how many people here have heard of 988? Not many hands went up, unfortunately. So, we're messaging through social media, we're sending out newsletters, we're talking about it every chance we can get, because the more people who are aware of this number, the more lives will be saved and the more people will have the opportunity to experience recovery.
Is there a misperception about what 988 is for? People might think it's only for suicide prevention.
I think there is a misperception, because the number is attached to the National Suicide Prevention Lifeline. And so people think it's only for really extreme situations. And it's somewhere in between really extreme situations and, so you just need someone to talk to. That's not really what the number is there for either. It's for mental health crises, broadly defined. And we would suggest people err on the side of calling and reaching out for support. No one should be hesitant to call the number. Worst case, if they're going to think your situation doesn't rise to the level of severity, they're still going to refer you to appropriate community-based mental health resources. So it's a great resource really for anyone who is experiencing a mental health crisis, and it's up to them to decide what exactly that means as far as the definition of mental health crisis.
How did the dispatchers work for receiving those calls? Is the demand and the amount of dispatchers even right now? Are dispatchers really busy or the opposite?
Well, they are definitely busy, and we continue to hear of clinicians at the 988 call centers working very hard, taking many, many calls per hour. We definitely need to build up our capacity in the call centers. Texas still only has 5 call centers. And as the growth of demand on 988 increases over time, we're going to need to add additional professionals working in the call centers. We may need to even add additional call centers over time. So that kind of leads to that next challenge of how do we fund these additional services, not just the call center services, but also mobile crisis outreach teams, crisis stabilization units, because we know some people are going to need more than just someone to pick up the phone when they call. They're going to need more robust, intensive services offered to them in the community. So funding is going to be a challenge.
Who are the people that are answering the phones? You talk about them being mental health professionals. What types?
Mental health clinicians of all kinds. Yeah. So it could be a counselor, it could be a therapist. These are highly trained individuals who have gone and received their education specifically to provide mental health support. So people calling that 988 number can expect to receive high quality services from the people that they're talking to.
Do you have any statistics on the communities that are actually using 988, and where it's succeeding and where the message needs to be pushed a little bit harder?
I don't have detailed data on, who is calling and who isn't, like based on where they live in the state. From what I understand, that people from across the state have been accessing the resource. We have call centers only in 5 areas of the state, but anyone can call and they will be connected to one of those call centers or an out-of-state one if there's not someone available at one of the Texas call centers.
The Suicide Prevention Hotline had a long number that was relatively well known. This one is so much easier to access. You just have to dial the 3 digits. Is that the message that needs to get out? Is that it's only 3 numbers away?
Absolutely. The barriers are low to engagement with this resource. And that was a big part of the thinking behind why having a 3-digit number is so beneficial. It's because it's going to become a household name, and people are going to eventually associate it just like they associate with 911. It just rolls right off the tongue. And it's something that everyone can remember. So it's a simple, low barrier way for people to access mental health resources. And we think that will lead to its long-term success.
And are you having success with the Latino community as well, or the Spanish-speaking community? Is this also servicing them?
Absolutely. I mean, this is a multilingual hotline, and if they get someone calling who speaks a language other than English, they're going to connect people with a clinician to the best of their ability, connect them with culturally competent, linguistically competent mental health services.
We talk about perceptions, about the fact that it's, people don't know that it's necessarily there. Is there also a perception that we've been trained that 911 is only for emergencies? Does that tag kind of follow along because you're starting with 9 and then this single numbers afterwards, that people might be a little confused?
I think there is going to be some confusion. I think the messaging needs to be refined about what exactly the target population is for, who this resource is available for. It definitely is available for more than just imminent mental health emergencies. We say it's available for mental health crises, but we worry, to your point, that people are going to think it's only for the most extreme cases and they're not going to call the number. Now, the good news is more people are accessing the lifeline than ever before. So there is some, understanding that it's for more than just imminent suicide prevention type of situations. But we're going to need to keep pushing that message and be as clear as we can that this is a mental health resource that no one should be afraid to call because they think that their situation isn't severe enough.
Do you feel that sometimes when you're having these conversations in, like different communities for your outreach program, that the conversation of actually using the number is secondary to actually translating or educating folks that, what mental health problems are, or what they are, and how to actually recognize the signs and symptoms so that they know they're at a point that they need to reach help?
Yeah, those two things need to go hand in hand. The 988 is not going to fix the fact that we have mental health stigma, that we have lack of awareness about what mental illness looks like, that people who are affected by it, whether they're an individual or a family member, often lack the training and the support to effectively engage in a positive direction long term, which is why, for us, we focus a lot on providing peer support services, educating individuals with mental health conditions about how they can best support their recovery, and similarly engaging family members and provide education, support, resources to family members. And as we do that and provide those basic skill sets and those basic sets of information, we're simultaneously promoting the fact that there is this incredible resource that is now available to them.
Greg Hansch is the executive director for the National Alliance of Mental Illness, the Texas chapter. Greg, thank you so much for the time.
My pleasure. Thanks for having me.